Our patients die 25 years earlier than the average American, which is just tragic in and of itself. So it's very wonderful to know that we will have a primary care partner that understands our population, where they're not discounted and dismissed.
A community behavioral health center and a primary care center in Mississippi offer combined services to make sure patients get whole person or both mental and physical care.
So much of what the person does is impacted about what the head feels like or thinks. So if you come into a situation, you're here because of your diabetes. And there's some things that you are not doing to manage your diabetes that might be related to what's going on in the head. So we need to connect the head to the body in order to provide that whole person, holistic care.
The collaboration between primary care and behavioral health care is the result of the Delta Center for a Thriving Safety Net, an initiative launched in 2018 with funding from the Robert Wood Johnson Foundation. JSI led a national Delta Center team, including strategic partners from the National Council for Mental Wellbeing, the National Association of Community Health Centers, and the Center for Accelerating Care Transformation. The goal was to advance policy change at the state and national levels and practice change among community health centers and community-based behavioral health organizations. Grantees use their Delta Center funding to support a broad array of policy activities, including background research, education and training, stakeholder engagement and convening, and building shared policy agendas. The Delta Center helped seed relationships that bloomed over time into powerful collaborations. Through funding by state associations and other sources, those collaborations led to significant policy victories and practice changes.
So there was very intentional in the trenches collaboration in which FQHC was paired with the Communal Health Center, and they actually worked together and bonded, providing holistic care because we're ultimately serving the same populations.
The Mississippi Association of Community Mental Health Centers and the Community Health Center Association for Mississippi, along with the Louisiana Primary Care Association and the Louisiana Public Health Institute, are part of the Delta Center Gulf States team, consisting of safety net provider organizations from both states.
We were able to work with 8 clinics. We formed a dyad of community of practice. 6 clinics were from Mississippi, 2 clinics were from Louisiana. We used those clinics as an entry point to be able to see how they felt about telehealth. Not only the staff themselves, but the individuals served as well. So we were able to get their input and make sure that's elevated into practice to be able to improve care for individuals served.
The Gulf States collaboration entailed more than telehealth.
We were able to elevate our work through the Delta Center with our CCBHC initiative. Mississippi is one of the 15 states selected for the CCBHC state planning grant, so that was very timely.
CCBHCs are certified community behavioral health clinics. Louisiana is also working on more robust behavioral health services.
The Louisiana Primary Care Association is working on a HRSA Behavioral Health Primary Care Integration Grant. So we're working to locate patients who need behavioral health services and to connect those patients with our partner federally qualified health centers in Louisiana to get the services that they need that they may not have in rural and underserved parts of the state. So I can see the work that we've been doing and what I've learned under the Delta grant applying directly to what I will continue doing.
Racially equitable healthcare is a North Star for the Gulf States team.
When we're talking about health equity or equity in general, we want to meet the person where they are and make an assessment of what those true needs are and then address them.
We started the Delta Center project. The goal was to advance racially equitable telehealth. And I think the beauty of this project is together we realized that access to care is what was at the core of that. Even though we focused on telehealth when we first started, our larger goal that we want to see is improved access to care.
This is about teamwork. This is not something that one organization or nor certainly one individual can do. It takes everybody working together, not just in Louisiana, not just in Mississippi, but in all 50 states and at the federal level to keep what we have gained sustainable for our patients for the future.